Hi everybody, I've come here to share my fresh knowledge that's come from my last CPD. If you get a chance to rewatch this, please do, because it's a bit mind-blowing, but it's also really important, and they say you need to hear things about 7 times to take it all in, which is quite incredible. Did you know? So they did a study on early arthritis. And the reason why I say it like that is because obviously we normally consider arthritis to be that of old dogs, but they did it on early dogs. And actually what they found was that 40% of dogs had arthritis in one or more joints, visual on radiographically visual, which is really quite a shock because you don't consider nearly half of dogs between the age of 8 months and 4 years old to be showing arthritis. And then they thought, well, what's the relevance of that? So they then looked at pain in those same patients, and they found that 16% of them had moderate to severe pain. They didn't even bother looking at the light pain because that's very hard to, really measure. So they just looked at the moderate to severe pain, which is really obviously quite bad. And they found 16% of them. So that's half of those dogs, pretty much, nearly half of those dogs that were found to have arthritis in one or more joint had moderate severe pain. And then they looked at the owners that could actually identify all of this, and they found that actually only 30% of owners could identify this level of pain, which that's actually, again, quite a scary statistic, because that means actually quite a low number of owners were actually able to see it, which is understandable because we don't have x-ray eyes, and it, until it's really bad, we're just not geared for seeing that sort of thing. So actually it's really understandable that that does happen, but also it's a little bit worrying because you want to be able to pick it out early, don't you? So where this information all went to is that basically the point is to say that we need to take time to actually really sort of watch and observe our animals, be aware that they could be in pain from an earlier age. How do we see that? That does take owner education, and that does take us to take some time to, go and do some learning about identifying early signs of pain. And then what that also leads to is then what do we do about it? We haven't got x-ray eyes. I wish I did. I really wish I did. And, it does make me always slightly anxious when we do mobility assessments, because in all fairness, you're trying to spot a needle in a haystack and it's not that easy to see. But doing an early assessment can pick up things in an earlier way. We can see things. I always say that it's, that's a blueprint or print of what we're seeing on that actual day and that exact assessment. Once they've walked out of there, obviously, who knows what they're going to go do in the park and all that sort of thing. But also, like I said, we don't have x-ray eyes, so we're doing the best job that we can with the situation that we've got and all the data that we've got and all the intelligence we've got from our education, which is great. And then obviously moving forward from that is how next do we actually deal with what we found out. So the next bit is the treatment of that situation. And then the CPD did further go on to back up what I do completely, which is lovely, because he said exercise therapy, which is fantastic. And as a physio, I was thrilled to hear him say that. He did also say things like, you can do pain trials because that helps you identify whether or not there's pain. But also what you can gain from a pain trial is that you can, if it is working and helping, then obviously you've got reduced pain, which means that you can then make your exercise therapy slightly more effective in that they will do the actions that you require them to do. I only use the word slightly more effective because obviously there is some benefit in having inflammation. If you use anti-inflammatories, then that can be a little bit of a sticking point. But if you've got no pain and then you can actually get on with doing the exercises, then that is definitely helpful, because if you're avoiding doing the exercises, then that's not very helpful. So yes, so you can get some pain meds on early doors, but he also did say that does not mean that you've got to have pain meds on forever. So don't panic. It doesn't mean that your young little baby has now got a lifetime worth of pain meds. That is not true at all. It just means that we have to look at the individual. So some of them, yeah, they might need a lifetime worth of pain meds. That's not unreasonable. But others of them, their pain will be reduced by the initial start of that course. Then any enhanced pain due to the fact that it's been going on for ages can be dampened, and then also your exercise therapy is kicking in as well, and that really helps. And I also want to add that they did also say we have to do weight control, which we've always known for a long time. That's a very key component. And also he suggested that you can get started with some of the nutraceuticals that are out there. The current evidence is definitely on the marine-based omega oils, that they can offer some pain relief, which is apparently actually proven as well, which is nice, and some various other benefits as well, which is a whole different conversation. So I hope you're all right with that mind blow. It's very interesting. So let's remember our early patients, and also the behaviourists have for a long time been saying that 80% of pain seen and 80% of behaviour issues seen in dogs is likely to be pain related, and this does back up what they're saying. So listen, look, and try and be your best advocate you can, and then let's get a team together to try and just help and support your dog through whatever life stage they're at. All right, thank you, bye.